everyone, and welcome back to Baby Wearing and Breastfeeding, the podcast where we do a deep dive into everything about baby wearing and breastfeeding, specifically tailored to our medically complex kids. Lots of good stuff in all of these episodes that apply to any family or any child going through bouts of illness. I'm your host. My name is Megan, and I am a lactation consultant, a mom to 4. One of my kiddos is medically complex, so that is why I'm very passionate about this topic. I am also the owner of Amphibibaby, so I'm also very passionate about baby wearing. So that is how all of this came about. Baby wearing, breastfeeding, medically complex kids, and sharing with all of you how those things have really helped me in my journey as a parent to a medically complex child, and just hoping that you guys get a lot of good stuff from these episodes. So today we're going to be talking to a licensed mental health therapist, and I cannot stress how excited I am about this episode. It's literally like one of the most important topics that we can cover. So we're gonna hit it hard. We're gonna go right into it. The mental health therapist we're gonna be talking to today is Sultana Kareem, and she has been a therapist for 12 years, and she is also a mom herself. So Sultana, thank you so much for fitting me in. I'm really, really excited. I literally cannot stress how important this topic is, because if it's just like, everybody has been on, well, most people have been on a plane. You know, you've got to put your oxygen mask on first before you attend to your kids. And so I've lived it, you know, lots of moms out there have lived it without even having the additional layer of a child with a medical complexity. So again, just thrilled. Can you tell me what was your interest? What led you into wanting to be a mental health therapist?
Actually my own experience. So I experienced childhood trauma and then some trauma in my adulthood. And I've had therapists throughout my life. And I was like, oh, some of the skills came innately to me. So I decided to take a class in high school. It was a psychology and sociology class. And I loved it. So that's kind of the segue into my career.
Yeah, that's really good, man. Those psych classes in high school and college were really interesting. I really like that you shared that. Of course, like, I think most of us, when we find our careers that we're good in, it's coming from a place of like passion. Do you know what I mean? Like, you lived it yourself, and so you are passionate about being of service to others.
Yes.
What I think I find that we're starting to get past a lot of the stigmas of saying, hey, yeah, I'm seeing a counselor, I'm seeing a therapist for this issue. And that makes me really happy that we're getting past these stigmas. So, you know, I remember going in and out of counseling. Actually, we did family counseling growing up when my parents were getting divorced, and then my mom was getting divorced again from my stepdad. And I felt like it was helpful, but I definitely, like, that was not talked about. It's been a long time. It's been a long time, but it was
Even
not
my
talked about
culture,
then.
it's not talked about.
Yeah, it was, and that was the thing. There's that big stigma. Do you feel like it's still really difficult for women to seek counseling for themselves because of a stigma? And what are your suggestions to getting past it?
I think it's a combination of stigma and societal and cultural expectations of what it is to be a mother. Because the idea, a lot of people, especially the clients that come see me, is like, well, I have to juggle it all, but you can't juggle it all and attend to yourself. And everything's going to collapse because you didn't tend to yourself. So I do a lot of education of why it's important to attend to your mental health, because oftentimes people say, oh, I can give to other people, I can be compassionate to them, but to myself, it's hard. And I was like, yeah, we all have that automatic thoughts that tend to be negative sometimes. And it's, do we get wrapped up in those thoughts that essentially impacts our feelings and how we behave, and essentially becomes a pattern of our own behaviors? And can we stop? Can we intervene? Being aware, like, we can't control initially our automatic thoughts that come up, our automatic reaction, but once we are aware of it, we can make a change. So, like, for example, if you believe that I'm a bad mom, identify ways that you are a good mom
Yeah.
and how you wake up every single day taking care of your little one. Go and take a shower for yourself to refresh, feed yourself.
What I hear you suggesting is like that's such a good tool
Mm-hmm.
is flip the script.
Mm-hmm.
If you recognize that you're having this cyclical thought pattern, like I'm a bad mom, because God, I feel like we learn guilt as little girls. We learn guilt
Mm-hmm.
as little girls because
Yes.
we are taught at such a young age to be everything for everybody else
Mm-hmm.
and not ourselves. But if you catch yourself in that negative thought pattern, flip that script in your head.
Mm-hmm.
And then the next thing it sounds like, because it's to me, mental health, or let's say taking care of yourself, right,
Yeah.
is a two-part thing. That's how I think about it. I'm not sure if this is right, and I definitely want to hear your feedback.
Yeah.
I think it's a two-part thing because I think it's the mind, but then I also think of actions. So I think of, okay, in my mind, I need to change what my voice is saying to myself, but then I need to physically move and like you said, take a shower or go for a walk. Like I need to do a task, whether that's physical or whether it's just writing, journaling, but like it's a
Mm-hmm.
two-part thing. So, what would you as a therapist, like, how do you approach it, from your standpoint, like when you're sitting in counseling with a patient, um, do you come at it like it's a two-part thing, or are there any other approaches that you take that kind of help parents stop in their track and
So I kind of think it as multidimensional because
mm,
so I look at mental health and wellness in a bigger
yeah.
spectrum because they all intersect each other
Ooh, yeah.
in terms of like you may be emotionally down, but you can choose to engage in physical activity, which will increase your mood and increase your behaviors
Yep.
outwardly.
Whole body approach.
Mm-hmm. Yeah,
Totally.
yeah.
Right. Oh, and so absolutely. So multidimensional is that the
Mm-hmm.
word that you used, right?
Mm-hmm.
Multidimensional.
Yes.
Perfect, right? Because
Yeah.
man, it's like that's much more concise and makes sense to me, because when you start getting your body moving, then your body releases endorphins and
Mm-hmm.
oxytocin, and then
Yep.
that helps the mood.
Yep.
So that's a really good approach. I like that a lot. And I'm just curious because I don't know this from like a therapist standpoint, but is there like a technique that you use, like a way that you were trained in school, and that's the approach that you it? And what are the techniques nowadays that therapists are using? Because I do know that like talk therapy is one, and then like
Mhm.
what are some of the other things? What do you use? What are the pros and the cons of each approach?
So I'm trained in a lot of stuff.
All the things. Yeah. Awesome.
um, so I tend to be very integrative in my approach depending on my client. I come from a very much trauma lens, so I'm looking at what happened to that person and what are the factors that play a role into what the symptoms they're exhibiting at this moment. And then how's it impacting their interactions with others? How's it impacting their social environment? How is it impacting their own like hygiene and physical being? Um, so it depends on what they want to work on. So I do utilize EMDR, which stands
Mm.
for eye movement desensitization and reprocessing. So when someone experiences a traumatic or distressing event, EMDR is used to help a person process that trauma. Because oftentimes trauma is stuck in the body and stuck in the mind, and what EMDR does is bring that connection back together, so
Is
that
that
so we can
anything
flush
like
out the nervous
tapping?
system.
Remember, I've heard of tapping. Like, is that fall
Yes,
into that, or is that something
yeah.
different?
It's one of the different types of bilateral stimulation. So some people can do like butterfly taps,
Yeah.
they can tap their hands. There's eye movement. There's audio. I do have buzzers that will buzz on each side too.
And what does that do? Like, does it help break up the thought pattern because you're introducing stimuli physical stimuli? Is that how it works? So like you introduce physical stimuli and it breaks up the thought pattern, or am I like way off base? How does it work?
It works by one, grounding the person's present moment by whatever bilateral stimulation, the word, and processing the trauma at the same time. So it's like almost having one foot in the past and one foot in the present, and processing the high distressing experience that they had related to that situation that's impacting them today.
So is it more of an integration? Like if
Yeah, yeah. So
okay.
I often ask them like, what is the image that pops up in your head when you think about that traumatic, distressing event? What is the negative thoughts you have?
Mm-hmm.
What feelings come up for you? Where's it located in your body? Oftentimes people put the chest, the lower back, the shoulders, and sometimes the jaw.
Interesting. Now, okay, now I'm curious too with where people hold it in their body. Is that unique to them, or would it be like, is it women, let's say, typically hold it here? Like I think of women holding it here in their shoulders and their chest, and then maybe men are in their back. I don't know. Is there any
It's
kind of
not by yeah, it's not by gender. It's more
interesting?
so
It's
like
just
how
person.
they
Yeah.
yeah.
Okay.
Mostly it's the jaw, shoulders, chest, sometimes the back of the head or the sides of the
Mm.
head, lower back. Yeah, and that's it, I think. Some people
Yeah.
do hold it in their stomach. Just depends on where they are. If they're
Yeah.
pregnant, there's some level of like
Yeah. Yeah.
determining if it's actually tension because of stress or is tension because you have a developing fetus in your body.
Yeah. Okay. So I want to wrap my brain around this. I'm very curious and I want to know how you would approach it because for parents out there with medically complex children, what I'm imagining, because I've been there myself, is that
Mm-hmm.
your day to day life is just your day to day life. Like, yes, it can be a struggle and difficult, but there are moments that have happened that are like almost cause you PTSD, right? Like, for
Mm-hmm.
example, I'll use I've talked to lots of moms, but I'll use my story to tell.
Yeah.
So the moment I will never forget is being in the hospital when my son was only a week old, and one of the physicians coming in and saying that, you know, your son most likely has to have a kidney transplant before he's one, but
Mm.
we can't do it until they're 22 pounds. And then the guy left. And so me and my husband are sitting there like, oh, so you just basically told us you think our kid's going to die. You know,
Mm.
it was horribly traumatic, like
Yeah.
instant sobbing from both of us, you know. And even though I very was able to recoup from that really fast because I realized like, okay, I'm missing a piece. Like clearly they're not just going to be like, go home and, you know, well wishes. You
Yeah.
know, clearly like there's some other treatment options. And, but, I was able to recoup from it fast, but it's never left my body. I can think
Mm-hmm.
about that moment and instantly, like you said, it is like a elephant on my chest. Like it's just so big and my brain knows that it's over. My brain knows that my kid's doing fantastic, like
Mm-hmm.
better than he should. He's my miracle, and that's why I call this podcast Baby Learning and Breastfeeding Miracles, because he's a miracle.
Yeah.
But so with my story, what like if I were sitting in your office and you were to
Mm-hmm.
say, okay, let's process that in one moment, like would I tell you the story and then like start tapping? How would that work?
It well with EMDR, you don't necessarily have to tell me everything,
Yeah.
and you can just there will be so maybe back up. Before we do EMDR, I will give you resources. Resources is coping skills because we're going to deal with high stress and distressing situations. And I want to make sure that you're prepared for what we're going to do before we go into it.
That's good. Yeah. So
And
you're
then,
prepping moms before you even do the big stuff.
mhm,
I love
yeah,
it.
yeah, because there's often a misconception like, oh, I want to do EMDR and we're going to get right in it. No,
Yeah.
I don't want you to just re-experience trauma, and I want
Yeah.
you to get some education first of like, how does your body respond to the distressing or traumatic event? What
Mm.
happens to your brain? Because often talks about flip the lid and
Mm.
noticing when you're dysregulated, you're in a flight, or anxiety or fear is happening, and what you need to regulate your system. And the same goes for like EMDR. We do a lot of time in that preparation phase before we move into the next step of processing the trauma. And during
That's
that
really interesting.
phase,
Okay, so there's a lot of prep work that goes into it. And I
mhm,
imagine when you say that, it's going to the amount of prep work you're going to have to do is going to be very case by case basis.
yeah,
Like which also case by case basis is going to be so multi-layered. Do you know what I
mhm,
mean?
yep.
So that's really interesting. So you're really having to evaluate the entire scenario. And then once you do start it, is there any like, okay, I'm just throwing this out there. Is there like, let's say you do 4 of those sessions, or is there a number of sessions that you do, and do they build on one another? Or, is it just like, we need like this many times before it sinks in? Like, how does that work?
So after we do the preparation, we'll move into the assessment and desensitizing phase, where, like I was mentioning earlier, of identifying the picture, the negative thought, and all those different components. And we'll do multiple sets of bilateral stimulation in session. And I often will check after each session of like each set of bilateral stimulation of like what's coming up for you, and then we'll continue until the end of our session. Some people I can complete in one session. Other people we may have to end, and always end with a coping skill and ways to take care of yourself, and then reevaluate the next session of what came up for you. Because oftentimes with EMDR, you do a lot of work in session, and then your brain continues to process the trauma that we've
Yeah.
been working on throughout the week.
Yeah.
And if
That's really interesting.
oftentimes during that time period, I often say like if something becomes too much or you start having suicidal ideation or homicidal ideation, contact me so we can debrief
Yeah.
and make sure that you're stable and you're safe.
Yeah.
And
Yeah.
then move to the next session and redo it again. Because sometimes we do one session, our level of distress is maybe like a 2 or 3, but you may come back in my next session with me and it's like a 5. And we'll just
Yeah.
continue the process until
Well,
it
life
becomes
happens
desensitized.
too. So it's
Mhm.
like you're working through things, and then life happens and your kids get sick a week before Christmas, and you've only gotten like 2 presents and you're not
Mhm.
finished shopping. And it's just
Yep.
all the
Yep.
things.
Yep.
So that makes complete sense. As we were talking, one of the things that came up for me is that, you know, I okay. I'm not out there saying that COVID was a good thing, but I do think that what COVID did was it helped put a spotlight on how important mental health is.
Yes.
Um,
Absolutely.
so okay, I'm taking the sunshine and the rain, like that was a good thing out of it. And I noticed, again, because this was my experience, that because COVID did a good thing, put a spotlight on mental health, that like, man, mental health workers, you guys, I don't know for you personally, but you seem really busy. You know what I mean? Like
Yeah.
you
Yeah.
seem really busy. And it
Yes.
almost became a
Yes.
thing where it's like, that you need to cope through things to be the best parent that you can be.
Hmm.
But I actually, right after COVID, found it really difficult to get in with a therapist, because if you're not having suicidal ideation, like you're not their priority.
Yep.
And I remember that was really difficult because, at least, and I'm sure for a lot of people, like, we went through a period where like that was difficult because we were having really big surgeries that year, and like I'm
Yeah.
like, oh my god, like I need to talk to somebody to process
Yes.
this. And
Yes.
like they're like, okay, we'll fit you in 3 months.
Yeah. It was crazy.
Okay. So yeah, do you fill up your schedule so much, like does it come to a thing where you're having to refer people out? Like, what other resources? So let's just pretend that somebody is having a hard time finding a mental health therapist that they can talk to, like we are talking face to face.
Yeah.
What can you point them to? Like, do you point them to groups? Do you point them to, like, I don't know, like on, like, is there AI mental health online? I'm not sure. What do you suggest?
So I suggest for them to first look at their out of network benefits,
Okay.
because there's a trend currently that's happening in mental health where a lot of therapists are no longer being paneled with insurances, for a lot of different reasons. But look, see if you have out of network benefits. And if you have out of network benefits, you can see a provider who is considered out of network. And there's more of us out there that's like, hey, let's educate about out of network benefits, because essentially what it is, your insurance will reimburse you for your care up to their level. Usually they have you meet their deductible first, and then there's a certain percentage that they will reimburse you for the care that you get.
I just had a really wacky doodle thought. And yes, I said wacky doodle, people. Like, I have 4 little kids. I say silly things. Um, are there like, do you know of any kind of like grants for parents of like medically complex kids if they need to see a mental health therapist outside of their insurance? Because sometimes insurance doesn't even cover it.
Yeah, some of them
And
don't have
then,
out of network.
yeah, exactly. And I mean,
Yeah.
parents desperately need it, especially if you're a new mom, especially if your brand new baby is like in the NICU. You know, maybe they're
Yeah.
just premature, but they really need it. Like, do you
Yeah.
know of anything like that they can get funding, to a little bit of help, basically?
Yeah, so in the DMV area, there's a foundation called Ally Foundation, and they'll
Mm,
pay a certain percentage of sessions. Usually it's like 6 sessions, up to six
that's
sessions they'll
awesome.
pay for, and the rest will be out of pocket. But it also varies depending on financial circumstances too.
Yeah, right. That makes sense. I'm sure
Yeah,
that they probably to be applicable for it, they might look at income and stuff like that. Yeah. Well,
yeah,
that's great
yeah,
that it's there. Like,
yeah.
that's really good
There's
to
there's a
know.
lot. So like it just depends on your racial and cultural identity. So there is, or sexual orientation,
Mm-hmm.
mental health liberation. They provide micro grants up to 12 sessions. Loveland Foundation does the same thing. Boris Boris Henson Foundation also does the same thing as 12 sessions. Postpartum Support Virginia offers micro grants. There are small grants to pay for mental health treatment. I think that's all that I work with.
Great.
Yeah.
But these are in the DMV area. So,
Some are global, some are
okay. And
currently.
but the my point for the listeners is what
Mhm,
you just said is they're out there.
mhm,
So
mhm,
some of the ones that you mentioned are global,
mhm,
and I'll put that in the notes for anybody
mhm.
who needs it. But then for the ones that are local, if you're not local to us, so for anybody listening, DMV is like DC, Maryland,
In
Virginia. So
Virginia,
that's
yep.
where we're at. But if
Mhm,
you're not in those areas, then I'm sure they like look for them. Like,
mhm.
they're
Yeah,
out there. So
yeah.
that's really good to hear because it's like really so valuable. Um, what are the long term benefits? So, a lot of times we think about doing, getting therapy because whatever is your trauma or whatever your challenge is, it's to the point that you're struggling to get through the day.
Yeah.
So clearly there are short-term benefits, right? Because you're going to
Mhm.
get therapy, you're going to be able to get through your day. But what do you see as the long-term benefits for parents?
Um, the capacity to cope, so you have your toolkit of different coping
Mhm.
mechanisms that work for you. Also being able to, so I do parts work, and a lot of that means building relationship with parts that we consider bad, like the anxiety and anger. Um, and know, like when you build a relationship with those parts of yourself, you'll be able to identify what do you need in those moments when you flip your lid and you're angry, or you flip your lid when you're anxious, and really
Yeah,
having that internal dialogue with yourself of like, okay, I just flipped out on my child and
yeah,
they did something very small,
right.
but something in me, something came up in me in that moment. And what is that? What do I
Yeah.
need at this moment that maybe wasn't met at the time?
Yeah, that's really good.
Mm-hmm.
What you're saying is you're recognizing in yourself what your triggers are,
Mm-hmm.
and then you're learning coping techniques so that the goal there is to catch it
Mm-hmm.
before it becomes this like full blown Darth Vader kind of
Yes.
outburst on
Yeah.
your unsuspecting toddler, or what
Yeah.
have you. And of course, levels of that are very normal,
Mm-hmm.
but we all strive to be the best person, the best parent that we can be.
Mm-hmm.
So honestly, just anybody, any parent would benefit from these things.
Yeah. And even
Um,
normalizing that, even you're gonna flip your lid, recognize that you're human.
Mm-hmm.
It's going to happen.
Yeah, it's going to happen.
Yeah.
I actually want to point out, because I don't even remember where I heard this, if it was a parenting class or something that I read, but we're all going to do it. We're all going to flip our lid at our kids, but what really makes the impact for them is how we come back to it.
Yep.
So how we come back to them and how we talk to them after the fact. So what do you suggest when we do that? So like, let's pretend we're having like bedtime wars, bedtime battles. Like, that's a legit thing for many of us.
Yep.
And many of us, it ends in yelling every night. So then we wake up and we feel guilty. How should we talk to our kids the next morning?
I think you should ask them what did they notice would happen? How did they feel when you started yelling?
Yeah.
And then validating their feelings of like, yeah, that was really scary when I was yelling. And Mama was really upset because I asked a lot of times, but that has nothing to do with you. That's about me.
Yeah.
In that moment. And then what can we do? What do you need now for me to feel happy or safe, or whatever words you want to use in that situation?
Yeah. Do you recommend, speaking of our kiddos, do you recommend when parents are going through something slightly out of the norm, like if they do have a child with a chronic illness, family therapy? And how do you approach that differently than you do one-on-one?
Not necessarily. It all depends on what our goals are. And if our goal is for us to communicate and to really articulate how we're feeling, then that's what we'll work on. Or if it's coping skills for everyone in the family, identifying what coping skill may work for one child or one family member is not going to work for the other one.
Yeah.
And make sure the parents have a toolkit of what works for each kid.
Yeah. I want to kind of go back to that toolkit thing, because you mentioned one coping mechanism may work really great for one kid, may not work really great for the other kid. But I think it's important to say that the reason why you want to have multiple tools in your toolkit, little visitor, multiple tools in your toolkit are because there are going to be times where that thing that always works you suddenly doesn't. And you need something else. So kind of going back to what I said, what happens when you have been using a tool, it's been working great, and then it all hits you. And that tool you've been relying on is not working. That's why we want to have multiple things to go to. But in my personal experience, what I have learned is it's trial and error, truly. So it's okay, what I learned was I found something through therapy that worked really great, but then this one time it didn't. And then I had to scramble to figure out what was going to work good the next time. But so then there's that kind of growing period where you have to kind of struggle a little bit, but then you grow from that, and then you've got one more tool, and then you build upon that. And so I think that's something that therapy does super, super well, is it helps you work through a lot of things so that you can start stair-stepping and adding to your toolkit. So what kind of ways do you suggest that parents approach that? Do they kind of approach it like you just gotta kind of go through the weeds, or is there a way to get ahead of it?
I think you have to go through the weeds because, like I was mentioned earlier, every different tool may not work for you, may not work for your kid. And it's figuring out and having a bunch of different options, because sometimes, let's say, deep breathing may not work for you. Maybe it's going to take a hot shower.
Yeah.
Or maybe it's going on for a walk, and having different variety as part of your wellness plan.
Yeah. I think that's really important. I think that's hard to hear. We don't want to feel okay, especially if your day-to-day is a struggle, to know that there's going to be moments where you can go a little bit lower. You can. But
that's the risk of also going to therapy, Like, the risk is you will experience distress, but the benefit is you will also be able to have higher levels of self-esteem, and it will improve your confidence in your own self and your ability as a person, as a parent, and all the different hats that you wear.
I'm sure I'm not the first person to make this analogy, but the thing that pops up for me, especially because we're an active family and we enjoy hikes and getting outdoors, is that it's the same as building physical strength. Like, you got to have, you got to really make your muscles tired to the point of discomfort and pain before you grow. And so it's the same thing with mental toughness and mental strength. You really got to stretch yourself, all out weeds until you grow. And so that's just life. That's just life. And whether or not you are listening and you have got a medically complex child, or whether you are just going through postpartum anxiety and depression, like, we're all doing that. We're all doing that.
Yep.
So really, really good to hear. So essentially, like, getting the tools for yourself, talking to a therapist, like, that's going to help all of us be better people. Just like, let's be real, guys, we all should be exercising. Like, I don't even care if it's just a walk, but we all should be, like, physical exercise and mental exercise.
I usually reframe it, because for some people there's a negative connotation with exercising.
Yeah,
so
please.
like any type of movement. I don't care. You do yoga, you just stretch, you go on a brisk walk, or maybe you just walk slowly, as long as you're outside. And
I love that you said that. I'm so glad that you said that. Please jump in and correct me. Yes. So exercise can be such a negative connotation for some people. Movement. Beautiful. I'm gonna use it from now on. We need to move. I like it. Thank you so much. So what would you leave somebody with? Like, what advice, what words of wisdom would you leave somebody with who is kind of struggling and they're on that precipice of don't I? Because it's hard to take care of yourself. What would you say to them to give them a nudge?
So a couple of things. One, you're not alone in your struggle, because oftentimes we feel isolated. We feel like the only one that is struggling. You're not. And it's okay to reach out for help. Oftentimes the stigma of, like, it's a weakness to reach out for mental health support. It actually takes a considerable amount of strength to admit that you need help. And then secondly, third, sorry, I'm going to write up the third one. If you have the financial resources to get help, please do so. And if you don't, it's also not a barrier. Just talk to the healthcare provider. Like, I'm considered an out-of-network provider that offer courtesy filing for out-of-network. But I work with, like I mentioned earlier, all those different organizations that make therapy accessible for those who are struggling financially.
Yeah. I'm going to just restate one of the things that you said, because for those listening, you guys are working really, really hard to figure out how to get the best care for your child. You're doing it all the time. You're looking for the right specialist. Sometimes we're like, okay, that specialist, I didn't like what they had to say. They had a terrible bedside manner. And then you're going to see another one. You just keep doing it. So if you're doing all of that work for your kid, you can do it for yourself. And how vital it is to do it for yourself. Because if you have put your oxygen mask on and you're taking care of yourself, think about how much more you have to give to your kid and to the rest of your family. So such good advice. Thank you so much, Sultana. It was so great to have you. Really, really good nuggets of wisdom. Yeah. Yes. And I also, again, I thought of one more thing that I wanted to say that you said. I wanted to pull it out again, say it again. Is that you're not alone, because so many people suffer alone and they just think, I'm the only one that is going through this experience at this moment, and you're not. And even if it's just like postpartum depression, or it's something, a little bit more serious. So, you may think, man, I don't know anybody else. Like, that was me. I don't know anybody else whose kid had to potentially have a transplant right after birth. Yeah. And I was like, I had such big feelings about it. It was hard to talk to people outside of my little circle. But the second that I did, I found out that I was not the only one. And that, believe it or not, even though specifically I may not know a ton of people that had this particular issue going on, man, were there lots of families around that had medically complex kids. And so we don't have to sit here and suffer in silence. Like that's the whole point of this podcast, is we're not alone. Yeah, so this is a voice for everybody. So thank you for reminding us. I love it.
Yes. And thank you for having me.
All right, it's great having you on. Everybody listening, we are going to air a new episode every Tuesday. So please join us on Tuesdays. You can listen in on Spotify, Amazon Music, and YouTube. So if you feel like you need to see our smiling faces, then you can watch or listen on YouTube. So everybody, enjoy your week. You're not alone. Stay strong.
Bye.
Thank you all for joining us on today's episode of Baby Wearing and Breastfeeding, Nurturing Miracles. I hope you found our discussion enlightening and that you leave feeling supported and empowered. Remember, you are not alone on this journey. Tune in next week for more insights and conversations that connect us all in the shared experience of parenting. Until then, take care and cherish every miracle with your little ones.